Yes, we had recently published a paper in Lancet Child and Adolescent Health looking at long-term survival of children with drug-resistant epilepsy. And that was using a national database from the Children's Hospital Association of over 18,000 children with the definition of drug-resistant epilepsy. They had different treatment cohorts. Some were continuing to take anti-seizure medications, some had cranial surgery for epilepsy, and some had vagus nerve stimulation. And of those, when you follow these cohorts, we saw that the patients who had cranial epilepsy surgery were significantly more likely to be alive at the 10-year survival mark. So they were 83% more likely to be alive. And then the vagus nerve stimulator group were 35% more likely to be alive. And this is compared to the cohort that was continuing to take anti-seizure medications. So when you look at that, there is a survival benefit of these patients that were studied over time, and of those who had received surgery. So if we look at over 18,000 children with drug-resistant epilepsy and the different treatment groups, those who were treated with epilepsy surgery were had the unconditional probability of survival at about 93% at 10 years, and then 89% for the VNS group, and then 89% for the medication-treated group. So when you look at who got the treatments, we're presenting a poster at AES to look at how these treatments appeared to be not received equally. So when you, well, about 57% of children in the study were white, and about 14% were Black, you could see that there was a much higher proportion of non-Hispanic white, well-insured, privately insured children who received cranial epilepsy surgery as opposed to continuing on medical therapy. And if you look at all comers in this drug-resistant epilepsy cohort, the non-Hispanic white children on private insurance were more likely to receive surgical treatment of any type, cranial epilepsy surgery or vagus nerve stimulation implantation. So there's a lot more work to be done. This is really only the beginning, but we're really highlighting some disparities in terms of access to epilepsy surgery care. And if you overlay that on how epilepsy surgery appears to have a survival benefit over this long-term survival timeframe that we see in the Lancet paper, this is huge in terms of significance, right? If you think about something like cancer, if you receive the diagnosis of cancer, we think about what we can do and what we can do to survive, right? To get this treated, in a timely manner, and to actually aim towards survival. When we think about epilepsy, we think about trying different medications. We think about all of the tools in our toolkit, including medications, ketogenic diet, and many surgical options now. The field of epilepsy surgery has evolved so much over the past 2 decades, and we have so much more to offer now, and we can look at it typically in terms of reduction in seizures, seizure freedom, improvements in quality of life, reduction in healthcare utilization, but now really to look at it in the lens of survival, and then actually knowing that we have good treatments, and we have good treatments that can really help people in so many ways, including having a survival benefit, and then seeing that there are disparities in terms of who might get these treatments that can help their quality of life and help their chances of living. And to see that Black children on Medicaid or Hispanic children on Medicaid are are appearing to be less likely to receive epilepsy surgery compared to non-Hispanic white children who are privately insured. This this feels not right. As a pediatric neurosurgeon and a health services researcher, that's not the way that we want to treat children or our patients. We need to give everybody the opportunity for a cure and for a better life. So we already know that there's underutilization of epilepsy surgery in this country for children and adults. And now we are seeing more and more benefits in different ways of epilepsy surgery. And we've really been describing it in different groups, different research groups, and really showing a lot of aspects of epilepsy care and epilepsy surgery. And now we're highlighting the disparities in access to epilepsy surgery care.